take care of yourself, how to give yourself some really good soft tissue work to manipulate the tissue around your foot and ankle. Easy techniques that I've honed over the past 25 years. Open up the foundation of your foot, which in reflexology represents our whole structure. The idea is if you start with your foot, we start opening up the foot and getting the foot and ankle to function as it's supposed to with propulsion. Also in your knee, creating a bow, which then as you straighten, flexes. Okay, here we go. Advanced self-massage for the foot and ankle with the arms straight to open up the shoulders. We're using that same movement, and what we're doing is just getting all those bones of the foot to have to shift. You can grab the entire side of your foot and press that external part, maybe the part that we're working on that's tight for the, we can press it down. As we press it this way, I'm pulling on the toe, on the big toe, in the opposite direction. So I'm pushing here, pulling here, and then doing it the opposite. I'm pushing with the toe and pulling with the lateral side. So it's back and forth, pushing here, pulling here, and then doing it the opposite. I'm pushing with the toe and pulling with the lateral side. So it's back and forth, and giving it a little bit of stimulation, a little bit of energy, focusing our breath on telling that arch of my foot, or what's going on with the top of my foot, to open up and let go, and then just being patient, visualizing our breath going in, our mind telling our body to open up. How much deeper can I go with that? The toes kind of opened up and spread out, pushing one toe forward, one toe back. Just hold a nice gentle contraction forward, and then you can pull back. Different directions, forward, backwards, lateral, twisting. So you're using your thumbs to, as I twist, you're using your thumbs to kind of hit one area and then push back and forth. So your thumbs can really be, as I grab it, I can start to use my fingers and thumbs to target more specific areas within the base of the foot. With the anchor call to motion, we're finding one spot. So this is kind of the warming up, the ringing, the push-pull. We're finding one spot that feels like it's a good area to apply some pressure to, okay? Usually along the arch, this is considered your spine. So it's a good idea to spend a lot of time, especially if you're dealing with plantar fasciitis. Can be really have a lot of tension along that arch. So I'm going to find one spot, target and sink in on that spot, and then the anchor call to motion is engaging that muscle under that direct pressure. So I'm pushing in and I'm moving the toes to activate that muscle under direct pressure. So instead of me, moving my hand and doing a massage like that, I just sink in, find a comfortable position, and then move the muscle under that pressure. Then we have the compression with activation. So if we're getting into the shin, I don't like to do a lot of massage, so this is just compression. So I'm just kind of squeezing the muscles with my hands, just like squeezing a towel. And then the activation, I move the foot and ankle under that pressure. And so really you're kind of exploring now, because I don't want you to tire your hands out. So I can feel some tension in my calf. Okay, so I'll take my calf, my gastroc, and my soleus, and I'll bring my hands together and hold that tension. And you're shortening that tissue, giving it a little bit of a challenge, and it can melt pretty quickly just doing that. So the shin, you can interlock your fingers, squeeze the shin, and then do that activation under that compression. And this is creating a massage stroke without me having to do a whole lot of work. So I'm just squeezing my hands, my palms together, applying a little bit of pressure along the tibia, on the inside and the outside of the tibia, and then doing small little activation movements. And that is a good treatment for the lateral shin. On to the star stack method for the foot and ankle. At my desk, I can take my shoes off, put this under my foot and begin exploring what's going on in the base of your foot. And so this isn't rolling, or I'm not going to roll over the activator because that's not really doing much. What we're doing is pinning and activating. So we're pin one spot, wait for the muscle to respond, and then activate it by moving the muscle under that direct pressure. The right duration, how much time do I want to target one spot? 3 to 5 minutes is a good amount of time to hang out in one spot and wait for it to relax. Sometimes it could take longer, and making this a consistent habit to get your muscle tissue healthy again. Okay, so the application went on my calf. Looks like that. Great. A little final activation is working on using that heel to toe movement. We recheck how your foot and ankle feel, and using that ankle for what it was designed to, which is propulsion. So you can just do a little back and forth movement, heel to toe, and just see what it feels like now, how much more energy you have. You'll see how it feels now with all that blood flow, all that work you've just done. You should feel a lot different. You should feel like it's moving better. Forward to working with you with the knee and getting into those quads and hamstrings and how they relate to the hip and up the chain. So we'll see you in the next video.